Good
Good
morning,
morning.
Dr. Milad.
Hi, Kim.
How
Thanks for
are
having me
you?
on. I'm good. How are you?
Of course. I'm very good, thank you. And thank you for joining us here on the Kim Pagano Show, The Brighter Side of Life. Tell us a little bit about yourself. And of course, I know we're talking about some of the things that us women have to go through, right? And give us a little bit more knowledge on some of the conditions.
Sure. Well, my background is that did most of my training in the Midwest at Michigan, Wayne State in Detroit, Beaumont, Oakland in Royal Oak, and then Mayo Clinic for my reproductive endocrine and infertility fellowship. And I've been at Northwestern for 26 years, serving as a fertility doctor, but then also a reproductive surgeon. And about 2 years ago, we had the chance to open up a multidisciplinary clinic designed for complex GYN conditions. So not the usual thing. We're not there to sort of do pap smears and so on, but we're there to sort of serve as a sounding board for second opinions for women that are having like a complex issue with in the pelvis. So the things that we sort of manage are things like endometriosis, pelvic pain, fibroids, ovarian cysts, vaginal abnormalities, uterine abnormalities, things like that. Things that a typical general OBGYN may not be comfortable managing. So that's what we've set up. And
wow.
Go ahead, I'm sorry.
No, go ahead.
I was going to say, so we've designed it so
and
that patients.
So,
I was going to say, we designed it so that
yes.
it's sort of like a one-stop shopping. So the intent is patients will come, will send in their imaging, they'll send in their CT or their MRI, their ultrasound images, not just the reports, so that we can look at them. And then during their visit, they may see several providers all in the same visit. They might see an interventional radiologist or a physical therapist or a physical medicine doctor or a psychologist, or a gynecologic surgeon, like all or none or some of those, depending on what the priorities of the patient is. So empowering the patient to tell us like what it is that they're looking for. Are they looking for an alternative to hysterectomy? Are they looking to get pregnant? Are they looking for pain control? Like whatever it is that they're looking for, we've designed it so that it's all in the same centers, one stop. It's a true multidisciplinary specialty clinic.
Wow, that's wonderful. Now, I'm looking at some notes here, and over 500,000 women have hysterectomies, correct?
Yes,
it's
that's right.
Actually one of the second most common surgery for American women. Is that throughout the country or not? So how, why is it so high here?
Well, that's a great question, actually. So it is extraordinarily high, and I think that's the message we wanted to get out is if you're not satisfied with the answer that hysterectomy is the option, you should be empowered to go with your gut and seek out a second opinion, because my guess is that there probably is multiple alternatives. And the question you asked about, like, is that true about where we are? Like that's a great question. It is very regional. Like certain parts of the country, you see almost no hysterectomies, and yet in other parts of the country, almost every other woman is having a hysterectomy. So it's very regional, and I think patients and their partners need to be empowered to ask the question: is this really necessary? That's the first question we ask. Is
something we need, right?
Yeah.
Okay.
Yeah. And when someone has a problem, like the first question we ask is, was it really necessary?
Right. And now what's interesting is C-sections. Okay. So everybody that had a cesarean, is that something that follows that? I had 4 C-sections. So I'm like,
time bomb.
Is there something common with that?
Yeah. So C-sections, to do a C-section, you have to cut into the muscle of the uterus. And most of the time, it's no problem. Like it's not an issue. But when we cut into the uterus, sometimes it doesn't heal exactly the same as it was before, and as a result, the lining of the uterus can actually grow into that defect, into that scar, and cause a condition called adenomyosis, which is a common cause of painful, heavy periods. So, so I think women that have C-sections are.
Well, I know that your time is limited, and where can my listeners find out more about this?
Well, they are welcome to take a look at our website. It's just migs.nm.org. So minimally invasive gynecologic surgery, migs.nm.org.
Well, very, very interesting. And I thank you so much for joining us here on the Kim Pagano Show. And I'd love to talk to you further about it another time.
Thank you, Kim. Thanks for having me on.
Thank you. Have a great rest of your day. Take care.
Thank you. You too.